Hey everyone, and welcome back for another deep dive.
It's great to be here.
Today we're tackling some really interesting marketing strategies specifically for home health agencies.
Especially in a tough economy.
Right? Every dollar counts.
Absolutely.
So we found this great document that's just packed with practical tips and real-world examples.
Oh, yeah, it's a good one.
So if you can imagine for a second that you're running a home health agency and you're looking to boost referrals,
Which is everyone right.
pretty much,
Mm,
we're going to uncover some of the most creative and effective approaches out there.
Looking forward to it.
All right, let's dive in. So one of the first things that this document really emphasizes is the importance of self-assessment.
It's interesting. We often think about marketing as, billboards and slogans,
Right.
but some of the most powerful strategies actually begin with a deep dive into, well, yourself.
Okay, so like the classic advice, take a look in the mirror.
Yeah, exactly.
But how does that actually translate into getting more patients?
It's all about an honest self-assessment. What are your agency's true strengths? Maybe you have a phenomenal specialized cardiac program.
Right.
But on the flip side, what are your weaknesses?
Ooh, good point.
Perhaps weekend staffing is limited, and that's something to address head on.
Right.
Identifying both helps you play up what makes you unique and attractive to those all-important referral sources.
So let's define that right off the bat, referral source. Who are we talking about here?
Great point. These are the folks sending patients your way.
Okay.
Could be doctors, hospitals, social workers, even assisted living facilities, anyone who can connect you with potential clients.
Got it. And the document really emphasizes the importance of impressing these referral sources. It's not enough to just exist right.
Absolutely. Take the story of Carillion Home Care Services.
Okay.
They were struggling to win over this vascular surgeon who was really skeptical of their nurses' skills.
Oh,
Their solution: they sent 30 nurses to the surgeon's hospital for specialized training.
whoa, 30 nurses. That's commitment.
Right, and it paid off. It wasn't just about boosting skills, it was about demonstrating they were serious about quality and building real credibility with that surgeon's entire group.
I see.
That action spoke volumes.
It almost sounds like home health marketing needs a bit of sales savvy.
You hit the nail on the head. The document actually highlights this. Strong sales skills are essential for marketers.
Oh, wow.
It's not just about dropping off brochures. It's about understanding the needs of each referral source, building genuine relationships, and persuading them why your agency is the best fit for their patients.
So it's more like being a consultant who truly wants to help, not just make a quick buck.
Exactly. And this idea of going beyond just the bottom line pops up a lot in the document.
Yeah.
It's about compassion, not just contracts.
I love that. Do you have a favorite example of an agency doing this well?
Meaty Home Health Agency really stands out.
What do they do?
They have a social worker on staff who goes above and beyond, connecting patients with all sorts of community resources, even things like housing assistance.
Wow, so they're not just providing medical care. They're looking at the whole picture of a patient's well-being.
And that sends a powerful message to referral sources. It shows them you genuinely care, and that builds trust and confidence in your agency.
It makes sense. Happy patients lead to good word of mouth, which is like marketing gold. But let's shift gears for a minute and talk about the importance of data. The document mentions this, right?
Absolutely. Data is a powerful tool. Even something as simple as a spreadsheet like what Bon Secours Home Health Agency uses can reveal amazing insights.
Ollie.
It's all about tracking referral patterns,
Okay.
seeing where they're coming from if there are dips and where there are opportunities to grow.
So if you notice a sudden drop in referrals from a particular doctor's office, you can proactively reach out and see what's going on.
Exactly. Data empowers you to be proactive and make informed decisions about your marketing strategies.
So instead of just reacting, you're getting ahead of it.
Right.
Okay, that makes sense.
Hmm.
Speaking of getting the word out, the document also highlights the importance of media coverage.
Oh, absolutely.
Right. That free publicity can do wonders.
Yeah.
But how do you make it happen?
It ties back to credibility.
Right.
Being featured in news stories is like free advertising, and it builds trust with potential referral sources.
Right.
The document suggests leveraging patient success stories, always being mindful of IP, of course, to attract media attention.
So maybe reaching out to local publications with an inspiring story about how your agency helped someone regain their independence after an injury.
You got it. It's a win-win positive press for the agency and a chance for patients to share their stories.
Okay, now let's talk about something that motivates just about everyone. Money. The document delves into this trend of performance-based pay for marketers in the home health industry.
Yeah, financial incentives are incredibly powerful, especially when every dollar counts.
Right.
It's all about aligning your marketer's goals with the overall success of the agency.
Can you give us some specific examples of how agencies are implementing this?
Absolutely. Capital Health Services moved away from a flat bonus system and started rewarding their marketers per admission.
Interesting.
And Fusion Healthcare boosted commissions for Medicare admissions during a tough recession.
So they're putting their money where their mouth is, so to speak, and directly incentivizing their marketers to bring in more patients. But are there any potential downsides to this approach?
That's a great question, and the document brings up a crucial point. Incentives work best when you've got clear, measurable goals.
Makes sense.
Fetzi Associates, a healthcare consulting firm, emphasizes this.
Okay.
They encourage agencies to focus on specific targets,
Like what?
like boosting referrals from certain payers, increasing admissions to specialty programs, expanding geographically, and this is key generating new referral sources.
Why is that last one so important? Wouldn't it be easier to just focus on the sources you already have?
Sticking with the same old sources can be risky.
How so?
What if a major referral source suddenly closes or changes their referral patterns?
Oh, I see.
You need to constantly cultivate new relationships to ensure a steady stream of patients. Think of it like diversifying your investment portfolio.
That's a great analogy.
Mm.
So for our listeners out there running home health agencies, what would you say is the most important takeaway from this section on goals and incentives?
It's all about alignment.
Okay.
If you want to grow your cardiac program, reward your marketers for bringing in cardiac patients.
Right.
If you want to expand into a new territory, incentivize them to build relationships with referral sources in that area.
Makes sense.
It's a win-win-win
Right.
for your agency, your marketers, and most importantly, your patients.
I love that. But you know what? This whole conversation has me thinking, what if we go even further? Beyond traditional referral sources, what are some truly unconventional strategies agencies are using to stand out?
You're thinking like a true marketing innovator. And you're in luck because that's exactly what we're going to dive into next. Get ready to think outside the box.
All right. We're back and ready to explore some truly unconventional home health marketing strategies. I'm all ears. What are agencies doing to break away from the pack?
Well, one thing that jumped out from the research is the power of community engagement.
Community engagement.
Sounds pretty basic,
Okay.
but it's about so much more than just slapping your logo on a park bench.
Okay. I'm intrigued.
Oh.
How does this translate into actual referrals?
Think about it this way. Home health agencies are all about helping people stay healthy and independent at home, right?
Right.
So by actively engaging with the community, they're demonstrating a genuine commitment to everyone's well-being, not just potential patients.
So it's about becoming a familiar, trusted presence, not just a business waiting for someone to get sick.
Exactly. The document doesn't get too specific,
Uh-huh.
but imagine sponsoring a local health fair, offering free blood pressure checks at a senior center, or even partnering with a community garden to promote healthy eating.
Right.
When people need home health services, guess who comes to mind first?
The agency that's been there all along. That makes a lot of sense. It's about building goodwill and top-of-mind awareness.
Now, here's another approach that really caught my eye.
Okay.
Content marketing.
Content marketing.
We usually think of this as a digital thing,
Yeah.
but it can go way beyond the online world.
Content marketing for home health. I'm not picturing viral TikToks here.
Definitely not. It's about addressing real concerns people have about home health care in a helpful, informative way.
Okay.
Think brochures, blog posts, even short videos.
So answering questions like, how do I even know if my mom needs home health? Or what kind of services are available?
Exactly.
Yeah.
By providing this valuable information, you're positioning your agency as a trusted resource, not just another business trying to make a sale.
It's about educating and empowering potential clients. I like that.
Now let's talk partnerships. This is where it gets really interesting.
Partnerships. Okay, lay it on me. Who are home health agencies teaming up with?
Anyone and everyone who serves a similar target audience.
Okay.
Assisted living facilities, senior centers, hospitals, the possibilities are endless.
Wow.
Think about offering workshops at an assisted living facility, providing educational materials to hospital discharge planners, or even co-hosting events with local community organizations.
So it's about leveraging existing networks and reaching potential clients where they already are.
Precisely. And building trust through those established relationships. Now, are you ready for a curveball?
Bring it on.
Technology is playing an increasingly important role in home health marketing.
Technology. Okay, we talked about spreadsheets. What else are we talking about here?
Think bigger.
Okay.
Telehealth, remote patient monitoring, even virtual reality are starting to make their mark.
Hold up virtual reality for home health care. How does that even work?
It's still early days,
Yeah.
but some agencies are using VR to give virtual tours of their facilities, simulate home environments for patient training, or even offer immersive therapy experiences.
Wow, that's incredible. It sounds both futuristic and incredibly practical.
Exactly. And it speaks to the adaptability and innovation that's happening in the home health industry.
It's about using technology to enhance patient care and make the experience more engaging and accessible.
Now, all of these strategies are fantastic,
Yeah.
but there's a common thread that ties them all together.
What's that?
Personalization.
Personalization.
Yeah.
So we're talking about going beyond the one-size-fits-all approach.
Absolutely. In today's world, people expect personalized experiences, and healthcare is no exception.
Of course.
It starts with understanding the individual needs and preferences of each potential client.
So recognizing that someone might be tech-savvy and prefer online communication while someone else values face-to-face interaction.
You got it. Agencies can tailor their communication and service offerings to meet those specific needs. It's about treating each person as an individual, not just a number on a spreadsheet.
And that builds trust and loyalty, which ultimately leads to more referrals and a stronger business.
Precisely. But even the most brilliant marketing strategies are meaningless if you don't know if they're actually working.
That's where measurement and analysis come in, right?
Exactly. We need to make sure all these amazing efforts are translating into tangible results.
Okay, so we've covered a ton of ground, from those creative strategies to the power of personalization. But now it's time to talk about the numbers. How do we actually know if all these efforts are paying off?
You're absolutely right. We can't just rely on gut feelings. We need that cold, hard data to guide our decisions. And in the ever-changing world of healthcare, tracking your marketing, ROI is more crucial than ever.
ROI, return on investment.
Yeah.
We're getting bang for our buck, basically.
Exactly. But it's not just about the dollars and cents. It's about measuring how effectively your strategies are achieving your agency's goals. So where do we start? Well, the foundation is understanding your referral sources.
Makes sense. We need to know where our patients are coming from.
Right. But it's not just about quantity. It's about quality, too.
Oh, okay.
Some referral sources consistently send patients who need more complex care,
Right.
which often leads to higher revenue.
So a hospital discharge planner might be more valuable than someone who occasionally recommends your agency to a neighbor.
Exactly. By analyzing those referral patterns, agencies can identify their most valuable sources and then focus their marketing efforts accordingly.
So if we see a dip in referrals from a particular hospital, we can dig deeper and figure out why. Maybe there's a new discharge planner we need to connect with, or perhaps there's a perception issue we need to address.
Now, beyond referrals, it's crucial to track your conversion rates.
Conversion rates, you mean how many of those referrals actually become admitted patients?
Precisely. This metric helps you understand how efficient your intake process is
Okay.
and identify any roadblocks that might be preventing those referrals from converting into clients.
So let's say we're getting tons of referrals, but only a small percentage are actually signing up for services. That might indicate a problem with our response time communication or even the clarity of our initial consultations.
It's all about connecting the dots and using data to pinpoint those areas where you can optimize your processes. Now let's talk about something a little less tangible. Brand awareness.
Brand awareness. It feels fuzzy, but we all know how important it is. Even if someone doesn't need home health services right now, if they're familiar with your agency, they're more likely to think of you when they do.
Exactly. And even though it can be tricky, there are ways to measure brand awareness.
Oh, really? Like how?
You can track website traffic, social media engagement, and even conduct surveys to gauge community perception.
So it's like putting together a puzzle, looking at all these different pieces of data to get a complete picture of how your agency is perceived in the community.
Here's the thing. All this data is useless if we don't do anything with it.
Right. Insights without action won't get us very far.
The key is to use data to inform your strategies, make adjustments as needed, and continuously improve your approach. Think of it as a feedback loop. Collect data, analyze it, make changes, collect more data, and so on.
It's a process of constant learning and refinement.
And in a world where healthcare is changing so rapidly, this data-driven approach is the key to staying ahead of the curve and ensuring your agency's long-term success.
So for our listeners who might be feeling a bit overwhelmed by all this data talk, what's a one key takeaway you want them to remember?
Data is your friend. Don't be intimidated by it. Embrace it, learn from it, and use it to make smarter decisions. Because in today's competitive market, the agencies that leverage the power of data will be the ones that thrive.
It's all about turning data into insights,
Yes.
insights into action, and action into results. Well, this has been an incredibly insightful deep dive into the world of home health marketing.
My pleasure.
We've uncovered some really creative strategies, discussed the power of personalization, and even tackled the sometimes daunting world of data analysis.
It's all connected.
It really is. Huge thanks to our expert for sharing their expertise and insights with us today.
Thanks for having me.
And to our listeners, we hope you found this deep dive valuable and inspiring. We encourage you to share your own creative marketing tips or any aha moments you had using the hashtag Deep Dive Home Health.
Let's keep the conversation going.
Absolutely. Until next time, keep learning, keep innovating, and keep making a difference in the lives of your patients and your community.